Any disclosure of pecuniary and non-pecuniary interests? No? Everybody's seen the minutes of the meeting on the 1st of July. Are you happy to agree those? Rosa, thank you. Move on to item 4, which is the corporate strategy monitoring report for Q1 of 2021-22. And I'm going to ask Donna Talbot, Head of Service, to take us through that.
Hello, thank you, Chair. The report has the same format as the report provided previously, and it takes the objectives of the current corporate strategy and identifies performance indicators which enable us to monitor the success of that strategy. So we're starting with, on page 13, where Lancashire will be the place to live, and we have a set of performance indicators in the table and some narrative on page 14. I'm going to ask Ridwan Musa to talk us through this indicator.
Councillor Edwards.
Thank you, Leader. I just want to follow on obviously what Ridwan said, just to reassure the committee of the work that is being put in and to try and address the backlog as we see it. And I think that it's useful that we remember that of all of the 4 KPIs when it comes to the safety defects repaired, the one that really it has got the most repairs that need to be done is that one within that 20-day time frame, and that is obviously that's probably the most important one to get the most defects repaired, and that one is the one that's performed in the green, and the other 3 are in red. But as Ridwan's rightly said, that is a seasonal red, as I addressed at the previous meeting.
Okay, thank you. Any other questions, points to make? Nope. So I'll hand back to Donna.
There's a performance indicator on recycling. I normally don't think you want to. You're covering the. There's a more detailed report on waste management. So moving on to page 15, we have Dave Carr, who will be taking us through the children's services element.
Okay, thank you. And the first one is the percentage of children and young people who've received targeted early help from Children and Family Wellbeing Services, which successfully met their identified needs. And it's an improving picture as services have recovered more face-to-face. Families have stayed engaged with the service. So we're looking at 70% for the first quarter. The second indicator is around the percentage of children looked after actually living in Lancashire, and our target is 80%. Again, slightly improving picture. I think there was a question at CCPI at the last meeting around what are we doing around that. A lot of commissioning activity to try and shape the market so that providers who are providing placements in Lancashire are wanting to work collaboratively with us to do that. We've obviously also got increased investment going into our in-house residential provision. So wherever we can, we're looking at ways where we can keep young people appropriately in their communities. But that's not right for all young people. For some young people, actually, it is completely appropriate that they are not living in Lancashire. So those are the first two indicators. Our educational attainment indicators figures will all be available in November, so we're not reporting on those at this stage. The next two then are on the percentage of primary pupils offered to one of the top three preferences, and same with secondary. And again, it's an improving picture on that. For primary pupils, then we're on 98.6 for April 21 and 96.3 for March 21 for secondary. And there's obviously a lot of work going on all the time in terms of school places, not without challenges, and we know that. But actually, in terms of the percentage of children or families that are able to get that top three, it's a positive picture.
Thank you. Has anybody got any comments that they wish to make? County Councillor Townley and then County Councillor Vincent.
Thank you, Leader. I just wanted to thank Dave for the improving picture. I think that is a very fast way of saying, of looking at all the work that goes on underneath to ensure that we are on an upward path, and that's exactly where we're heading. Thanks.
Councillor Vincent.
Yeah, I think it's to reiterate that. I think it's an excellent picture, Leader, and I am very grateful that it is, and I think we'll be the envy of many other authorities that we have so many parents who are going to be satisfied with the fact that their children are going to the schools that they want them to go to.
Yes, very good. And yeah, thanks from all of Cabinet, I would say, for the work there, and to all the staff who are carrying it out. Is an improving picture, but it's good to know that it is, but we recognise all the hard work that goes into it. Thank you.
Okay. Health checks are normally reported at this point as well, but we actually have Sakthi here today to talk through the public health outcomes. So we're picking that up later in the agenda. Looking at the next set of indicators, it's the percentage of adults and older people whose desired safeguarding outcomes are fully met and care homes rated good or outstanding, and Ian Crabtree's in the.
Thank you, Chair. So safeguarding outcomes, it's good that we've seen an improved position against concerning the proportion of people who've had their safeguarding outcomes fully met. So that's gone up to 65%. So we're pleased with that, but we're still below, I think, which is a rather ambitious target of where we want to get to in terms of 70%. We don't report on those people who've had their outcomes partially met, but as you can see in the report, we got 97% of people who feel that. And it is a corporate priority that we do, it is important that we keep the most vulnerable people safe. And what we have seen, although there's been no suggestion that the impact of the pandemic has seen safeguarding queries go up, we know that people have not been going into care homes. We know that people have not been in touch with loved ones. So we will see some of that start to materialise, I think, over the next few quarters. So I think it's important that we recognise that. In terms of care homes and the quality in care homes, we're in line with the national target now in terms of 82%. Again, I don't think we'll see much change in the figures over the next couple of quarters, and certainly not in this quarter, because CQC, which is the regulatory body, have not been going into care homes in particular. So they're reliant on the care homes in terms of providing that information to them. And of course, we'll see a lot more people visiting their loved ones in care homes now, which is excellent. In terms of the County Council's in-house provision, which we provide 16 care homes, 12 of those are currently rated as good. We have had one that has had an inspection, and that's gone down to requires improvement, which gives us 4 as requires improvement, which is not a position we want to be in. But we've got a rigorous action plan around those 4 care homes about how we improve that and how we get those back to good in terms of that. But I just don't think we will see much fluctuation in those with the current CQC regulation. We also run, as part of the disability services, 8 short break services across the county, and all of those are good, and two of those in particular are outstanding, which is quite hard to get an outstanding rating in residential care. So the fact that we've got 2 out of the 8 is a testament to the great service that the disability services provide. In terms of community service providers, as you can see, we've got 96% of community care providers at good or outstanding. Generally, community providers do have higher CQC ratings than residential, so you would expect to see that. But also that we have 9 services that we operate through our disability services, and one of those is the largest shared lives scheme in the country, and I'm sure has been reported back on previous occasions, but is outstanding on all 5 key lines of inquiry with CQC, and all of the supported living schemes that we run are good. I think that's it. I think I've got to the bottom of the 3 indicators. Thank you.
Thank you. Thank you. I mean, it is really good to see those positive measures, and it will be very interesting to see at the next update how the safeguarding outcomes start to come through. We shall see. They may not do, but we will see. Anybody want to raise any questions or comments? County Councillor Gooch.
Yes, thank you, Leader. I'd just like to pay tribute to all the people who work in the care homes, both ours and the private ones, and those who go into other people's homes to look after them. And particularly, you know, the people in the domiciliary care have got extremely good results, as we can see. As Ian said, we did have a bit of slippage in a couple of our homes, and it will be a rigorous process looking into it to bring them up to the level we want. I mean, on the safeguarding, I mean, it's very ambitious to have a target that requires you 100% satisfaction. That's very difficult to achieve. So as long as it's partially gets up to 90%, that seems to be doing very well in all the circumstances.
Councillor Vincent.
Yeah, thanks, Leader. Just a question really on health checks, and it's for Saxley as much as any as the service providers here. Obviously, face-to-face provision of GP practices is a very important issue, and it's becoming even more important as we see health issues arising that are non-COVID related. What are we doing, and what can we do to persuade GP practices to restart and to do more face-to-face checks, not just for our care home people, but also for our general population, because it is clearly important to get GP visits face-to-face as soon as possible.
Exactly. Do you want to answer that now, or do you want to pick it up later?
I'm very happy to pick it up in my bit on the health checks, but there's a wider issue as well, which is really important, and we need to ensure the access is there for our residents. Okay, we'll come back to it. Thank you. Anna, do you want to go on to the next section?
Yes, so we're now on to Lancashire will be the place to work. And I'd like to invite Dave Carr to talk about the library.
Thank you. So I won't go through each indicator one by one, and we know where we were in terms of libraries and closure. The library's fully opened or reopened on the 12th of April this year. So what you're seeing in the first quarter is that sign of recovery. So in terms of visits to libraries, there were over 250,000 in that first quarter. I think we've talked before about the e-downloads and the huge number of e-downloads which have happened during the pandemic, but also a shift to more online events. So whilst there has been an increase in terms of library events organised as they've reopened. Actually, the numbers who are engaging through some of those events are very significant. PNET again is recovering, still relatively low, but we would expect that to increase as the year goes on.
Thank you. County Councillor Buckley.
Yes, thank you. I think as this is in my portfolio, I think at first glance with all the red boxes there, it could be quite embarrassing, but I think we all understand the reason behind that. I think I just want to question the comment that they were fully open on the 12th of April. I think it was fair to say that they were all open, but not all the functions were fully open, because obviously there were limitations of various kinds. So I think that needs to be reflected in there. What I think would be interesting as we do come out of getting to full recovery and residents start having that more confidence to visit our library establishments, is how the e-downloads will come, whether that actually stays at a level, or whether there is almost like a trade-off between the number of e-downloads and people visiting the libraries to see if the different demographics. But I think we'll only find that out in time. But that'll be interesting to see. Thank you.
Councillor Buckley, no, sorry, not Buckley, Townley, sorry.
Yes. Yes, indeed. Leader, just also I think it should be noted that until we can actually get a significant number of people into some of our smaller satellite libraries, that our face-to-face events are very much curtailed. And that is part of the raison d'etre for our libraries, is interaction face-to-face, whether it be with people or books as well. So I think, you know, we have to take some of these figures with a pinch of salt until that is fully up and running.
Thank you. Okay, Donna, take us on to the next part of the report, please.
Back to Dave.
Okay, thank you. So the next two indicators, the percentage of young people in employment, education and training, and then the same for SEND pupils. And it's been an area where there's been a huge focus over the past few years, an improving picture. And it's really an example of the great partnership working that's happening with our schools and with our post-16 providers, who are working really well with children, young people and families and our services. So that collective effort is really starting to make a difference in terms of supporting those young people to have a sustained transition. Thank you.
Okay, anybody got any points that they want to raise? I mean, I know personally, it's really pleasing to see those EAT and EAT SEND figures improving as they have, and I do know and recognise all amount of work that's gone into all of that, but I also recognise that it is not easy to achieve such a quite a significant change around in a relatively short space of time. So that's to be commended. County Councillor Townley.
I know that Councillor Ria would like me just to thank the staff because of it certainly has been an incredibly difficult task to get and keep some of these percentages up. And we fully appreciate the difficulties and the work that goes into it. Thanks very much, Dave.
Okay, move on to the next section.
I think it's back to me on exclusions, isn't it? So the final indicator in this set for children and young people is proportion of children excluded from school. So the target or the figure is green at the moment, 0.09% for 1920. Have to say, because schools weren't fully open through some of that period, we don't quite know kind of what the picture will be like. But addressing exclusions generally is one of our priorities within the draft education strategy, and that'll be coming through to Cabinet in December. And there's an awful lot of work that's going on with schools to look at how we can support them to avoid that step of exclusion.
Okay, anybody want to make any comments on that section? Councillor Townley.
Again, this is a quite controversial, but also a very necessary step, but nothing is ever undertaken lightly. and the work that goes into to reinstate these children, and also where that isn't possible to keep them in education. I think we go over and above. And again, my sincere thanks to the staff.
Thank you. Thanks to Dave. Now, I think we do hand over at this point. So, Donna.
Hand over to me to hand over to Ian this time. So we're looking at the percentage of adults with learning disabilities in.
I'm glad to give Dave a rest. So this figure's not moved much over this quarter, which isn't surprising really in terms of the impact of COVID on people with learning disabilities. Many people have not been able to access community facilities. Some have been shielding. We've also had the specific employment team that has worked to get people into employment. They've been redeployed within the council to lead on other areas. So that team's back established now. I'm also hopeful that given the current job market and the vacancies, that we should start to see some improvement within this indicator over the next, the next quarter really. So hopefully we'll start to see an increase in that figure.
Thank you. Oh, County Councillor Gooch.
Yes, it is an area in which we always have difficulty in getting people with learning difficulties into employment. Of course, one of the problems is, although they have been shielding and things like that, also many of the jobs that they've traditionally done, particularly in catering facilities and places like that, just have been closed for ages. We haven't done well on it in the past. We're still working on it and hope with the new group looking at it, we can do better in the future.
Thank you. So I think we move on now to Lancashire will be the place to prosper. Is that right?
Yes, I was hoping that Andy Walker was going to be able to present, but it is a comprehensive narrative against the data, so I can just take you through that generally. You can see under the Rosebud, the narrative under the Rosebud just explains that we've had challenging trading conditions, and because there's been similar and alternative loan products on the market, the appetite for borrowing is low as well, due to more incentivised government loan products taking precedence. So we've also got businesses sitting on cash, and the performance in this quarter doesn't look too bad, but actually that is the deals taking longer to complete the previous quarter, when actually it was a zero investment period. There is a pipeline of around 900,000, and trading conditions are expected to be tougher this coming year, so the forecast is being adjusted. The Boost ERDF support, which is the European Regional Development Fund core programme, which is targeted at supporting high growth businesses to achieve the potential, they had a decrease in outputs over the past year, which could be attributed to businesses responding to the pandemic with their focus moving from growth to survival. So Boost adapted their service to support those businesses through inquiry and advisor provision. So inquiries for the 2021 financial year were almost 2,500, compared with inquiries from 1920 being short of 2,000. So that was an increase of 611 inquiries. The Boost advisors have given over 2,000 hours of business support to over 1,600 businesses needing COVID advice and guidance. The Boost Recovery Grants, under the umbrella of the Boost ERDF, the Business Growth and Innovation Service is set up from scratch and implemented small capital grants programme to support Lancashire small medium enterprises in their response to the impact of the pandemic. So this has involved the review of over 1,000 expressions of interest and the issuing of over 500 application forms to enable businesses in the County Council, Blackburn with Darwin and Blackpool areas. And this was in addition to the planned work priorities of the service. So the expression of interest was released in August 2020, with full applications being distributed in September. I think that's it really.
Anybody got any questions? County Councillor Riggett.
Thank you, Leader. And first of all, apologies for being late, and I will have to excuse myself in a few minutes as well, colleagues. All I wanted to add is Donna went through it very clearly, very well. Just want to reassure colleagues that we're very focused on supporting businesses. The team have evolved the services as they needed, as the report lays out. And I think it's important that we look at the wider picture here. Well, maybe we're below some of our targets. If our overall target is to support businesses with the best advice available to them, and there are more competitive, better ways to support them through government schemes, and we direct them to that way, that will ultimately help the long-term growth of our business, and our numbers will return when we are the right provider for those services. Thank you.
Yes, thank you. Anybody else? Any points? Councillor Vincent.
I think what a lot of the economic indicators in here are showing is how quickly the economy is bouncing back from COVID, and that's great to see. And in particular, when you see the target for new businesses for this quarter, the target was 5, and they've actually hit 54, which is quite some overachievement. 40 new businesses, the quota before, against a target of 10. So what we're seeing is rapid growth, bouncing back to where the economy was, and long may it continue.
Here to that. Anybody got any other points you want to raise? No? Okay.
Moving on, the objective, Lancashire will be the place to visit, was slightly hindered by the pandemic, unfortunately. So we're reviewing our approach to this with an annual report being scheduled. So moving on to Lancashire will be the place where everyone acts responsibly. The public health outcomes in Lancashire, we have Sakthi here who's going to be doing the report separately. And so it's back over to Ian to pick from the percentage of older people still at home 91 days after discharge.
Yeah, a good figure really in terms of the percentage of people who remain at home once they've been discharged from hospital. Slightly under our target, but still performs well against the national average. It's a constant challenge in terms of to keep people at home and keep people supported, and the services that we work, particularly all the rehab services that we have in place, are performing well and are enabling people to remain at home, and long may that be the case. Obviously, given a large authority, we work with a significant number of hospitals on the patch, and we're trying to improve all the time the information that they give us in terms of to make sure that we know who's being discharged and who needs the support to be provided. In terms of the proportion of adults with learning disabilities who live at home, we're below the target that we've set, but again above national averages. The Northwest has always been a centre of excellence, really, in terms of people with learning disabilities who live in community settings. We don't use residential settings as much as possible, so, and that's reflected in some of the figures further down. So we've had a strong history of supporting people in the community, and some of the new schemes that we're developing, particularly around apartments, which Councillor Gooch spoke last time, some of those are coming to fruition now, and we're seeing people supported in really good quality accommodation. So really good work going on in Lancashire around supporting people with learning disabilities. The proportion of adults and older people receiving long-term support supported in the community, again, just slightly under in terms of the Q1 target, but for a whole range of reasons, really, in terms of the pandemic. People have wanted not necessarily to call on care services during this time, but we are seeing a change in terms of those arrangements, and people now starting to ask for more home care and more support. Permanent admissions to residential and nursing homes for younger adults, 18 to 64. We perform well in terms of not having people going into residential care as the default option. And particular progress we've made is around people with mental health issues who traditionally have been reliant on residential services, and we're seeing more and more people supported in the community now, and that's been a really good change over the last 12 months. In terms of permanent admissions to residential and nursing homes for the age 65, I would like to take some credit in terms of this, but we know that people have been very hesitant to go into residential accommodation. But as you can see, the numbers are beginning to increase, and So we'd still like to be able to be in the position that we can support people out in the community rather than in residential care. But we also know that we've got a residential care market that does need to have people within the care homes as well. So it's getting that balance right. But we're quite pleased with the figures as they are in terms of people not going, because previously we've been red on this indicator. So.
Anybody want to raise any questions? Councillor Gooch.
Yes, on the people over 65 remaining in the homes 91 days after discharge from hospital, we only need 5 more to stay home to bring that up to target. And in 46 days, I hope to knock that down to 4. On the accommodation for working age people with learning difficulties, yeah, as Ian says, we've been struggling with that because we're building these very good apartments for them. But because of the pandemic, the planning process has slowed down. You can't get builders as anyone's trying to get building work done. So that's slowed everything down, but we're still going ahead with that, and it will produce very good accommodation for those people.
Thank you. Anybody, anything else? No? Okay, so we now move on to the heading on it. We on to sickness absence. And yeah.
So as you can see from the figures, the sickness absence was at an all-time low really in April at 10.64 FTE days per FTE. It's gone up slightly, and that is a pattern across the country. I think we've looked at benchmarking with other councils, and they are displaying a similar trend, indicating a slight increase. But I'd like to just ask Mike Kirby to explain a little more about the benefits that we've seen with our ways of working. We're planning for that to support us to keep the sickness absence.
Thank you, Donna. I think one of the things to recognise is that it did seem very strange when we looked at sickness records that when improved during a pandemic. We understand that some of the aspects of different ways of working that we've introduced during the course of the pandemic have helped contribute to that. But I think we also need to recognise that during that period, we've had an awful lot of staff continuing to work on frontline service delivery, continuing to engage and mix with people. So we do need to recognise that these figures have improved, and part of that improvement, I think, is down to people isolating. Part of it will be down to improved hygiene practices, etc. But some of that will be down to different ways of working that we've enabled during the course of the pandemic. And what we're trying to do at the moment is to develop a programme of activity that looks at the way that we work to make the council as flexible and as responsive as it can be going forward, and as efficient as it can be going forward. I do recognise that within that we clearly need to focus on customer needs and ensure that we're meeting those, but also that we meet staff, colleagues, service delivery needs as well of that as part of that process. But it is ongoing activity. We are looking at other councils as well to understand what they've done that's introduced benefits and improvements in terms of sickness records. But of course, those improved sickness records mean that as an organisation we are being more efficient and hopefully more effective as well. So really what we're trying to do is make sure that we capture as much of the benefit as possible, and hopefully these figures will then continue to maintain a positive trajectory.
Anybody got any questions that they want to raise? No? Okay.
So last but by no means least, the revenue forecast outturn percentage variance to budget. We've actually got a Q1 forecast of an underspend of 5.2 million, which is 0.59% of the county council's net budget. But it does say they'll be closely monitoring the impact of the pandemic, and we're expecting that there could be significant variation from the current forecast at a later date. So watch this space. key message. I think that concludes my report.
I think it'd be good at the next committee if we also had the report accompanied by the risk register, because we could then look at both the risks and issues that we're facing, but also the performance outcomes. So if we could arrange that for the next meeting, that would be good. Thank you. So item 5 on the agenda is public health outcomes, and Sakti's going to take us through that, but also hopefully pick up some of the other issues as well. Thank you. So over to you.
Thank you, Chair. Good afternoon, members. First of all, I just want to thank staff for making this meeting as closer to the new routine as possible whilst we're still in the middle of the pandemic, and for the members for your continued enthusiasm and leadership in steering us through the pandemic. And also, it's good to be here, not to talk about COVID for once, and go back to, or not go back, but look at the core duties that we carry as an organization and as a team in improving lives and health and well-being of our residents. I'm going to introduce the report, highlight the key outcomes and performance of public health services. I'm conscious that we've not had a whole look at public health for a while, so treat this as a first of many, and then in the coming meetings we'll highlight individual service performance and we'll pick it up from there. So in that context, I just wanted to reintroduce the meaning and remind colleagues of what we mean by health. And it is complete physical, mental and social, and dare I add, spiritual well-being, and not merely absence of disease or infirmity. And that is a very important globally agreed meaning of health. And if you look at what determines our health and well-being, only about 20% of our health is determined by clinical or care services at the point of need. Access to good quality, timely care contributes to about 20% of our health and well-being. That means the rest of our health and well-being is determined by education, income, jobs, housing, transport, environment, access to green space, and how we are enabled to live healthy lifestyle, including smoking, alcohol, diet, and so on and so forth, including mental health and well-being. And that's an important issue I want to highlight, because when we say health, we tend to think about NHS and we tend to think about social care, and that's where most of our money is invested, and quite rightly so at the point of need. But when we're talking about public health and improving outcomes, we mean the health in its truest sense. And also that highlights the impact of economy on health and well-being, as well as the steps that you will soon see as I describe it. The steps that we are taking to improve health and well-being is also good to improve our planet's health. And they are all quite interlinked when you look at the determinants of our health and well-being. Therefore, we as an organization have a huge influence and an opportunity to make a difference to the health and well-being of our residents. And in that context, the report is set in broadly 3 parts, including the appendices, starting with the outcomes, so the impact, the collective impact of all our activities and our partners' activities as measured by life expectancy, healthy life expectancy. The second part is, what do we do within the council? And by that I mean the public health team, as well as the rest of the parts of the council. That's the way it's laid out. And I'll just begin with some of the key outcomes to highlight to members. When we measure health outcomes, we measure how long someone's expected to live and how well someone is expected to live. And there's a number of determinants. Actually, we are doing, just putting the outcomes to one side in terms of what determines our outcomes and how we are doing on that. We are less noisy county. We have access to more woodland than the national average. We do very well also in terms of having less overcrowding as an average. There's always a variation in the county, but as a county council area, we have less overcrowding. We really support our people with learning disabilities very well. The levels of unemployment compared to the national average is better. Homelessness as an average is better. The youth justice system and how we support children and pupils' absence, these all are better outcomes that determines our overall health. But when it comes to the overall impact and how we compare against the national average, 10 years less likelihood of living that life expectancy. And if you add healthy life expectancy, that's 17 years less. So that is a long period of time to live with a disability or health condition. And that really shows us that we've got a lot of opportunity to add years to life as well as life to years. This is where I then go into that report about how well we are doing and what is our approach to improving health and well-being. In essence, the logic, if you will, in plain terms, to improve our health and well-being consists of three parts. Services to people at an individual level, improving community level well-being by promoting community groups and promoting community assets, including natural assets. And then the third arm is embedding well-being in all the policies that we make, whether they are social policies, economic policies, or environmental policies. So that's the logic. And the public health team is a small team. We have core expectations in terms of delivering certain statutory services which are outlined in the report, but we also work with other expertise in the council to influence health and well-being, including our partners. The prize is really huge. In the county, there's an opportunity to add £10 billion extra to our economy if health-related issues can be mitigated in our economy, which is £35 billion. So it's huge opportunity in front of us. And I'm just going to jump straight to public health services now. We have, as listed in the report, certain essential mandated services that we are expected to deliver, services like health visiting, school nursing, services like health checks, contraception, sexual health services, and alcohol and drugs and substance misuse services. But the pandemic has impacted these services differentially. Just to draw out examples, we seem to have done very well in supporting our babies and mothers and children through our health visiting during the pandemic. We also seem to have done well in our alcohol and substance misuse and coexisting mental health issues with our residents during the pandemic. Certainly the alcohol and substance misuse services are regarded as one of the best systems in the country as well. So that's how those two services have performed. Whereas if you look at sexual health services, people trying to stop smoking, they have, and Nhs Health Checks particularly, they have, well, I'll come on to Nhs Health Checks in a minute, but sexual health services and tobacco, the percentage of people who have been supported to successfully deliver the outcome has continuously improved, but the numbers of people that were going through our services have really declined in the last year. And that is a worry because we haven't quite picked up things to prevent the earliest opportunity. Now, Nhs Health Checks might warrant a bit more deeper dive, and I'll briefly mention that. I'm happy to pick any questions. These services, they are aimed to pick up high blood pressure, chronic kidney disease, diabetes, early signs of dementia in apparently healthy individuals. So these are people who don't know that they have anything, and we invite them to provide that health check. And when we detect something, we then pass it on to the NHS, who are responsible for managing these conditions. The main provider of these services have been our general practitioners. And as you can see from thousands of people receiving health checks over the last few years, that has plummeted to a couple of hundred in the last year. And that in practice means people who have blood pressure, who have diabetes, who have chronic disease and early Alzheimer's dementia, they may not have been detected during this time. And there is a pressure in the health service. There's a huge backlog, pent-up demand. And what happens generally is the opportunities for prevention always takes a backseat because we are dealing with the fire in front of us. And that is still a huge issue. And one of the things that we're doing, just to respond to Councillor Vincent's comments earlier on, whilst they're not busy, they are busy primary care practitioners, but the number of people that they can get through, given that they still have to maintain NHS works to higher levels of infection prevention control standards, is that people who have urgent care needs or people who have suspicions of cancer and so on, they get fast-tracked, and people who don't have immediate urgent care needs, including those who would have otherwise got health checks, they tend to get remote checks and so on. So one of the things, what we're doing is we are exploring other options. We will still want to work closely with our general practices in managing people who have high blood pressure and diabetes and so on, but we are exploring other options, including taking the health checks into the community where people frequent. It could be libraries, it could be other settings, including leisure centres and workplaces where we have already got a small number of people getting the health check. So that's what we are currently considering in improving the performance of NHS Health Checks as a service. Just segueing into overall performance again and our path to recovering public health performance. COVID has really had a big impact, and that's pretty much what we've thrown everything that we've got in keeping our county safe and managing through COVID. We didn't even have a front door, for instance, and now because we tend largely to commission services, but we are managing various incidents and outbreaks. We have started a public health reform program. We have got 3 strands to that. We will continue to respond to COVID and other threats and emergencies, but we are starting to recover these services and the performance that we have lost during the pandemic. And we've prioritized, we've continued to prioritize young babies and children, and continuing to maintain the performance of health visiting school nursing services. And we've also prioritized health checks and healthy weight and obesity as the next 2 services that we've chosen to really look into the performance and improve it significantly, whilst also trying to work out different ways of improving well-being, working with partners, district councils, NHS, and so on and so forth, to improve that community well-being through various initiatives. So that's our program. I just want to go back to the recommendations, being that this is the first time in a long time we are having an overview and looking into public health. We want the support from this committee for improving the performance of public health services, but more importantly, as outlined in the report, but more importantly, a recommendation to embed improving public health agenda as part of our core corporate strategy and how we monitor that going forward. I'll leave it there, Chair. Thank you.
Thank you. Number of questions. So, Councillor Buckley first.
Yes, thank you, Secretary, for that. Very interesting. If I can, I just want to focus on the mental health aspect. On page 35, the bullet points in the delivering mandated public health services. I was surprised that there wasn't actually a specific bullet point for mental health services, because I think we all recognise the last 18 months has put a great strain on a number of people, and I think that's a hidden aspect that's going to really sort of raise its head in a significant amount of of importance. And then just going back to the previous agenda item, when Mark was talking about the staff, the sickness absence, I'm just sort of rereading the document, which says that in where was it, the greatest the category, mental health related illness remains the top reason for absence, accounting for 38% of days lost, and that's from the staff. And I think this is just permeating through society, and especially my worry really is the young those who will be leaving schools and universities, there will be the 20s, so they're not in the sort of like an establishment setting, but in the the wider community setting, and how we are addressing that, because I think that is an issue that's going to raise its head significantly. And I'm surprised it's not identified as a separate thing. That's all. Thank you.
Thank you for pointing that out, and such an important aspect, mental well-being, mental ill health. The bullet points there on page 35 are what has been identified nationally as part of the statutory delivery services to be delivered. We do have a range of services, particularly supporting young people, suicide prevention, as well as, you've noticed that alcohol and substance misuse isn't even identified there as a statutory mandated service, but we do. That's a service that we spend quite a lot of our money. So just to reassure members, although it doesn't feature as, the bullet point is what is nationally identified as a statutory mandated services, but we actually spend quite a lot of our resources in supporting people's mental health and well-being, and also including our own staff. So working with Mike and colleagues across the corporate services, we have a specific well-being at work program that one of our staff and team are engaged in, and there's more to do. This is probably one area when you look at economy and health and how these can connect in terms of the productivity and so on. Well-being at work does take quite a lot of quite a lot of impact in our workplaces, and we've just planned to meet up between cabinet members and service leads to look into that as a stand of work. Thank you, Councillor Buckley.
Thank you. Councillor Turner.
Yeah, no, thank you. It was ever thus the prevention argument, and it does, like you say, always ends up taking a back seat because real-time economics kick in, and like I say, we fight the fire, even though to help Graham out, we could be doing quite a bit more of that. And absolutely right that it's embedded across all departments. We should look sideways every time we do, both ways, sideways. Every time we we introduce something or change something or bring in new infrastructure, and try and close that gap that we've missed. We've missed opportunities in the past, and it just adds value to everything we do. And I think it's really important. So, happy to work with you, particularly in this role. Yeah. So we'll work together on this, and I'm sure all the colleagues will do the same. But let's get that added value into it.
Thank you.
Councillor here.
Thanks, Chairman. I don't need to add a lot to what's already been said, but I think the importance of this document to me is embedding it in the culture of the County Council. And there are so many links right across the different service areas, right across portfolios, that can and need to be made and need to be strengthened. And just linking my previous portfolio with my current one, and productivity was always an issue for businesses and the economy, and that's definitely linked towards health. So the two interlink in both directions, and we need to make an impact on the health checks. Absolutely, we need to make changes, and we need to take them out to communities, and because we're just not seeing the results for obvious reasons in a lot of cases. But we need to get them out to where people are. And I think that's particularly true for men, actually, who don't like going to GPs. But if you take the checks to where they may be, whether it's in a work environment, whether it's in a social setting, they are more likely to engage, and we can pick up on some of these triggers and some of these aspects which have a massive impact on the NHS and our services moving forward. Board sets out the key areas of transformation. We've seen them before, but it's just stressing again the importance that we place on the Best Start in Life, the Healthy Arts programme, and that community wellbeing right across. So it's a good report in my view, but there's a lot of work to be done moving forward, and that will involve all of us collectively working on this. Thank you.
County Councillor Ali.
Yeah, thank you, Chair. Can I start off by thanking Sakti, his team, for the tremendous work they've done, particularly in the pandemic, and been on the front line. In terms of report, I just want to pick a couple of points, and some of them have been covered. One was around the Healthy Child programme, which is all those issues. I think with kids going back to school now. Is, you know, we need to give that important. Around mental health, we have done work around mental health in the past, around pilot work, and put some money into that. I think that's really going to be crucial moving forward over the next couple of years, particularly pandemic still being there and life trying to get back to normal. And one, I was looking at the Respond, Recover and Reform, which is on page 37, where 3 main strands for the programme, the Public Health Transformation Programme, and they're really, really good. The one thing which I didn't want to pick up on was the fact that, you know, with public health, we've got to influence all of our other partners, and in whether it's the Health and Wellbeing Board or through some other mechanism, there's a real issue on the ground, and which Alan picked up on, which is around GP seeing people face to face. There are some really good practices out there who are trying to get back to normal, but there's a lot of practices which very rare you can get an appointment with a GP face to face, and particularly elderly people. You know, some of them who've not left their home for a long, long time are frightened of going out. And just for them, technology and just doing a telephone consultation, they don't know how to use Skype or Zoom or whatever it may be, FaceTime. It's a massive issue, and we've got a backlog on the NHS as it is. And I think there should be a strong, clear message from powers to be to say, look, actually, you know, where you can, please start seeing your patients face to face. And I know quite a lot of staff who work for various GP practices in the east of the county. And, you know, sometimes it is the practice themselves. The GP is quite comfortable now in the role of saying, well, actually, I can get through this and go home, and doesn't want to go back to seeing face to face. And I think that's a major, major problem. And that's not going to help with the prevention agenda. We need people to see GPs early. And if there is interventions, then they can go down the 2-week cancer check or health checks, other things that they can do, which will stop us clogging up beds in hospitals.
Thank you. Do you want to comment on that, Saxby, before we move on to County Council?
Certainly, the health checks program, we are in discussions with the NHS colleagues, and then the broader issue of the GP face-to-face. I'm more than happy to pass that message on and get any feedback and pass it back to this committee. Yeah, thanks.
County Councillor Gooch and then County Councillor Townley.
Yes, I think we all seem to be agreed on the importance of community care and community health. That's very important. So I do hope that a substantial percentage of the money the government is raising from its national insurance levy comes to local authorities, so we can prevent people ever having the need of the NHS acute services.
Point well made. County Councillor Townley.
Yeah, I've got 2 points actually, Sankey. Thank you very much. I mean, this is fundamental. The public health of our county, of our people, is fundamental to how we are going to perform on the national stage. That sounds rather too grind dry, really, but it is the truth. For myself, I agree entirely with County Councillor Gooch that we need funding to come down so that we can implement the choices, the social prescribing choices of people. And I'm especially interested that our youth should be much more active, which will make them much more less inclined to be visiting those doctors' surgeries. So all I can say is that there's anything from my side that I can do, I'd certainly be pushing for that. The other point I think was on the doctors' surgeries. I have to say that I can only speak for myself, but with an elderly parent, I have to say that some of the Burnley surgeries have been absolutely top spot.
Councillor Vincent.
Yeah, thanks, Leader. Yeah, thanks for picking up on the GP situation. I echo Councillor Ali's concerns, and obviously that's why I raised it, because I do think there is an issue around this, and that too few GPs who are going back to where they were, seeing people face to face. I think particularly with the elderly, it's very important to do that, because Councillor Ali again is right, and need face-to-face contact, because a lot of them do not have access to or are able to access Zoom calls or whatever the alternative is, and they have only a limited value anyway, in my view. There is nothing better than seeing a patient face to face. I don't want to. My own son, for example, had a knee operation recently, and 6 weeks later, had his first telephone appointment with physiotherapy department, which didn't do a lot of good. And the consultant who we saw subsequently hit the roof, and he had to have urgent physiotherapy, and actually got a physiotherapist down into the consulting room to express his value of physiotherapy over the time. And that's the sort of situation that we're in now, and it has to stop. We have to have a situation where we go back to where we were. If we're going to come out of this and we're going to get health back on track, everybody has to do their bit. And we are being innovative, we are being creative, and we're stepping up. We haven't had any funding to do that. So those who are getting additional funding need to step up to the mark.
Thank you. Do you want to comment on that, Zach, apart from nodding your head and agreeing? Okay, I mean, I think we, well, I'll speak personally. I totally agree with that. If we're actually going to reach, to bridge that GVA gap, which you mentioned at the beginning of your report, we have to start getting these things back to normal. Yes, we can embed all of this in policies, and absolutely ought to, but we need our partners to step up as well to help us. So absolutely endorse that. I also endorse that it's really great to talk about something that's non-COVID related from the public health perspective. So as a committee, are we happy to support the recommendations of? Thank you. Right. So we have no urgent business, and our next meeting is on the 25th of November at 2 o'clock. We issued a notice of intention to conduct business in private. We haven't had any representations about that. So is everybody happy to exclude our press? There are no public here, but they could be online, press and the public. Yeah. So we'll just wait until